Homeless populations in San Diego, Santa Cruz, and Los Angeles counties are experiencing hepatitis A outbreaks. The virus, which attacks the liver, is usually transmitted through close human contact and infected feces. Reporter Stephanie O'Neill takes us to San Diego, where an ongoing outbreak has killed 16 people, sickened nearly 450, prompting a public health emergency.
It's a Friday morning, and a team from the Alpha Project, a nonprofit that serves San Diego's homeless, drives me to a crowded encampment in downtown San Diego's East Village, an area that's largely hidden from the city's tourists and residents.
We're going to go to what we think is probably the epicenter of this whole outbreak.
Larissa Wimberly is an outreach supervisor. She sits shotgun as caseworker Kane Mariscal drives us to the homeless encampment where the virus is rampant. Today, they'll hand out hygiene kits.
How many people would you say is down there?
Probably about 300.
Yeah, about 300 people. Intense. It looks like a war zone right now.
Urinating, defecating between cars, between tents.
On the sidewalk. It's everywhere. It's just really bad right now.
So bad that the city, under the direction of the county health department, is now power washing heavily soiled sections of downtown sidewalks and streets with a bleach solution. And earlier this month, the county installed about 40 portable hand washing stations throughout those downtown areas hardest hit by the virus. Katie Keach is spokeswoman for the city of San Diego.
We're working on other issues, including the addition of public restrooms downtown, and we'll continue to do whatever it takes to address this.
The outbreak is the worst of its kind to hit the state since the U.S. approved a Hep A vaccine in 1995. And because an outbreak associated with poor sanitation is so rare, there's no state protocol to control it. Wooten says battling it in San Diego means trying whatever possible to stem its spread.
This outbreak has really resulted in us needing to be creative and utilize strategies different from what we've utilized in the past.
One approach, pairing public health workers with the Alpha Project and other homeless outreach teams. That's because they know the people living on the streets and the canyons and wildlands of San Diego County. Many of the homeless, Wooten says, are already sick, which makes them especially vulnerable to the ravages of Hep A.
5% of them have hepatitis B, and about 20%, almost 20% have hepatitis C or some other type of underlying medical condition.
Wooten says the on-site visits allow health workers to offer the Hep A vaccinations to the homeless where they live. It also makes it easier to educate them about this infectious liver disease that's landed more than 300 people in the hospital. Among them, 42-year-old Leslie, who asked us not to use her last name. She's been camping out on San Diego streets for 5 years and became ill with hepatitis A last spring. Hers was among the first of nearly 450 cases confirmed by the county so far.
It was awful. My skin was yellow, my urine looked like chocolate milk, and everything just hurt, like I was achy all the time and tired. I couldn't sleep enough.
It took Leslie more than 2 months to fully recover, but she says she's grateful to have escaped with her life from an outbreak that county health officials say continues with no end in sight. For the California Report, I'm Stephanie O'Neill in San Diego.
Are you interested in the future of learning? Then check out the Mindshift podcast, where we explore new innovations in education and how they shape the way kids learn. Find Mindshift wherever you get your podcasts.